I'm Dr. Ellie Stein. Welcome to my video tip of the month for June 2024. In this video is, will immune modulators help people with long COVID? Part 3, Maraviroc and Atorvastatin. This study is being led and promoted by Dr. Bruce Patterson. He hasn't yet posted it on clinicaltrials.gov, so I've kind of taken what information I can from a recent paper that his group published of 18 people who were successfully treated with his protocol and a podcast interview he recently did. Dr. Patterson hypothesizes that many, if not all, of the symptoms of long COVID and possibly ME, chronic Lyme, can be explained by something called chronic endotheliitis. This is an inflammation of the tiny cells that line our blood vessels. He believes that this inflammation is due, in the case of long COVID, to persistence of the spike protein being carried around the body much longer than it should be by cells called non-classical monocytes. Now, these are phagocytic cells. They're part of the innate immune system. Their job is to go around eating stuff and destroying it. But he thinks that in the case of long COVID, they're eating the spike protein, but somehow they're not disposing of it properly, and this causes chronic inflammation. So his treatment protocol is aimed at reversing this putative cause of long COVID by blocking 2 receptors on the endothelial cells that he believes are promoting chronic inflammation. First drug, Maraviroc, is a drug used in HIV, and Dr. Patterson used to work in that field, so he's very familiar with it. It blocks a receptor called CCR5, and in so doing, stops these angry non-classical monocytes from traveling all through the body, wreaking havoc, and according to him, actually reprograms them so that they're not so inflammatory. The second drug, Atorvastatin, is a statin, so its primary use is to lower cholesterol. But many drugs have additional uses which are less well known. In the case of statins, they're also anti-inflammatories. And they bind to a specific receptor called the fractalkine receptor, which allows the virus to get into the non-classical sites in the first place, or the spike protein. And fractalkine, when it's overactive, stops these cells from undergoing apoptosis or cell death and getting cleared from the body. So a drug that could block fractalkine could help these angry non-classical monocytes live out their normal short lifespan as they should and get rid of the cause of the chronic inflammation. Now, Dr. Patterson says that he's also going to randomize about 300 individuals, half getting the treatment, half not. To get into his study, you have to have long COVID, meaning ongoing symptoms for at least 3 months. And although he hasn't said it, I'm guessing that he's going to test all applicants to the study with his proprietary cytokine panel, which measures 14 cytokines. He's published a paper showing that this panel can accurately differentiate people who have long COVID from people who have acute COVID, people who have ME, and people who have chronic, or what's now increasingly being called long Lyme. So probably he's going to want to do this test to make sure they actually have long COVID before he lets them in the study. The duration of the study is uncertain. I'm guessing it's going to be about 12 weeks because he says that after 12 weeks, the majority of people are cured. And the outcome measures, based on previous research, is probably going to be a combination of subjective symptoms and a repeat of this cytokine panel to see if the signs of inflammation have gone down. I don't have a proposed completion date, but I can say Dr. Patterson is someone who gets things done pretty quickly.